Hypertension. High blood pressure or hypertension is one of the most common cardiovascular diseases. Blood pressure refers to the force of blood pushing against the artery walls as it moves through the body. High blood pressure can threaten healthy arteries, and it is the leading cause of stroke and a major cause of heart attack. In most cases, there are no warning signs of high blood pressure. There are two types of hypertension: essential or primary hypertension, which makes up about 90% of the cases. It has no known cause and develops gradually over time. Secondary hypertension is primarily due to renal, liver, or some endocrine disease. Some medications, such as birth control pill, cold medicine, prescription drugs, or over-the-counter pain meds, can also cause secondary hypertension. And this also develops gradually over time. Measuring blood pressure. Blood pressure is determined by the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. The more blood your heart pumps and the narrower your arteries, the higher your blood pressure. A normal blood pressure is 120/80. The top number, 120, is the systolic pressure, and the bottom number is the diastolic. A normal blood pressure is 120/80. The top number is the diastolic pressure, and the bottom number is a normal blood pressure is 120/80. The top number is the systolic pressure, and the bottom number is the diastolic pressure. When your heart beats, it contracts and pushes blood through the arteries to the rest of your body. This force creates pressure on the arteries. This is called systolic blood. A systolic blood pressure of 120/139 indicates prehypertension or borderline high blood pressure. A systolic blood pressure of 140 or higher indicates hypertension or high blood pressure. Blood pressure guidelines. A normal blood pressure is less than 120/80 milligrams of mercury. Elevated blood pressure is a systolic between 120 to 129 and diastolic less than 80. Blood pressure guidelines. A normal blood pressure less than 120/80 milligrams of mercury. Elevated blood pressure. Systolic pressure between 120 to 129 and diastolic less than 80. Stage 1, hypertension, systolic between 130 to 139 or diastolic between 80 to 89. Stage 2, systolic at least 140 or diastolic at least 90 milligrams of mercury. Blood pressure guidelines. Normal blood pressure less than 100 over normal blood pressure less than 120 over 80 milligrams of mercury. Elevated blood pressure, systolic between 120 to 129 and diastolic less than 80. Stage 1 hypertension, systolic between 130 and 139 or diastolic between 80 to 89. Stage 2 hypertension, systolic at least 140 or diastolic at least 90. Hypertensive crisis, systolic over 180 and or diastolic over 120. If this occurs, patients need prompt changes in medication if there are no other indication of problems or immediate hospitalization if there are signs of organ damage. The guidelines stress the importance of using proper technique to measure blood pressure, home blood pressure monitoring using validated devices, appropriate training of healthcare providers to reveal white coat hypertension, which essentially means that when we go to the doctor, our blood pressure tends to be a little elevated because we're usually anxious when we go for a health encounter. Identifying socioeconomic status and psychosocial stress as risk factors for high blood pressure that should be considered in a patient's plan of care. Risk factors for hypertension. Age. It increases with age. Men over 55, women over 65. Race or ethnicity. Its highest rate is seen among African Americans who also develop it earlier in life. African Americans are also twice as likely Risk factors for hypertension. Age. Hypertension increases with age. Men over 55 are at high risk, as are women over 65. Race or ethnicity. Hypertension is highest among African Americans who also develop it earlier in life. African Americans also have twice as high the rate of hypertension compared to whites. Other risk factors: sedentary lifestyle, smoking, including secondhand smoke, obesity, high sodium diet, a low potassium diet, a low diet in vitamin D, high alcohol intake, stress, elevated blood lipids, and other chronic diseases. Hypertension can develop secondary to other health conditions, or what we call comorbidities, including diabetes, chronic sleep apnea, a drug-induced hypertension, kidney disease, steroid therapy, thyroid disease, and some other disorders. Signs of hypertension. Hypertension is known as the silent killer because 1/3 of the people who have it don't know it. Fortunately, high blood pressure can be easily detected. Signs of extremely high blood pressure: severe headache, fatigue, confusion, vision problems, chest pain, difficulty breathing, dizziness, nosebleeds, irregular heartbeat, blood in the urine, and pounding in chest, neck, or ears. Complications of hypertension: aneurysm, stroke, heart disease, kidney disease or even kidney failure, hypertensive retinopathy, which is elevated pressure in the eye, erectile dysfunction or impotence in men, preeclampsia in pregnancy, metabolic syndrome, and problems with memory and comprehension. Diet and hypertension. Sodium, sometimes loosely referred to as salt, has a direct relationship with hypertension. Sodium is sodium chloride as the chemical formula. High salt intake may increase the risk of hypertension by 50%. A high sodium diet causes increased muscle tone and arterial resistance, thus increasing blood pressure. The Dietary Guidelines for Americans recommends consuming no more than 2,300 milligrams a day of sodium and no more than 1,500 milligrams per day of sodium should be consumed by people who already have high blood pressure, people who have diabetes or chronic kidney disease, and African Americans, as well as middle-aged and older adult. Calcium has an inverse relationship to hypertension, but the exact mechanism is not known. This means that high intake of calcium tends to decrease blood pressure. Calcium is involved with many physiologic processes that influence blood pressure. And 2 to 3 servings a day of low-fat dairy products are recommended. Potassium also has an inverse relationship to hypertension, which means that high intake of potassium tends to decrease high blood pressure. Fruits and vegetables are naturally high in potassium, and 5 to 7 servings a day of fruits and vegetables are recommended. Magnesium also has an inverse relationship to hypertension. No clear association between dietary magnesium and blood pressure, however. Magnesium is a potent inhibitor of vascular smooth muscle contraction and may act as a vasodilator. Some lipids have a direct relationship to hypertension. Polyunsaturated fats relax vascular musculature, and the saturated fat ratio of 1.0 or more may lower severe hypertension. So you want to have a polyunsaturated fat ratio to saturated fat ratio of about 1.0. Diets high in omega-3 fatty acids reduce the risk for hypertension and heart disease. It should be noted that 5% of the hypertension in the American population is due to alcohol consumption. Consuming 3 drinks a day is the most common cause of reversible hypertension. And hypertension affects 30 to 60% of alcoholics, with women being more susceptible than men. The DASH diet. The dietary approach to stop hypertension, or the DASH diet, has been proven to lower blood pressure, reduce cholesterol, and improve insulin sensitivity. It is endorsed by many health organizations and meets the dietary guidelines for Americans. The DASH diet emphasizes fruits, vegetables, low-fat dairy, lean meats, fish, poultry. And you should review the DASH handout for more information. Lifestyle management of hypertension. Start always with a lifestyle modification. Achieve and maintain a healthy weight. If obese, reduce weight to within 15% of desirable weight. Consume no more than 2,300 milligrams per day of sodium. Get 30 minutes per day or more of physical activity. Consume 5 or more servings of fruits and vegetables. Limit alcohol to no more than 2 drinks a day for men and 1 drink a day for women. And manage stress.